Hi guys, we just wanted to walk you through what a physiotherapy appointment looks and feels like now with the new COVID measures. So first off, we ask you to come about 5 minutes before your appointment starts. If you come earlier than that, just wait in the car until about 5 minutes before your appointment time. When your appointment time comes, if you are bringing a mask from home, please put it on before you come in. If not, don't worry, we have one supplied for you. You just come in the front doors. We do wipe down the doors with a medical grade cleaner after every single person, so don't worry about touching the door handle, and you'll actually get a chance to wash your hands once you get a little closer to the clinic, so you don't need to worry about that either. Come on in. I'm pretending to be the patient today. And the hallway is the same, but we have been a little busy painting and getting ready for you. So Ray or one of the physiotherapy assistants will probably be waiting for you here, but if not, we just ask that you sit on this chair that also gets sanitized regularly after each person, and you just wait until somebody can come and greet you. And when Ray greets you, she will offer you, if you don't have a mask already, she will offer you either a cloth mask, which Krista Dryden and her children have graciously made for us and donated for us to give to you, or a surgical mask. The advantage of the cloth mask is that you can wash it and use it again and again. So if you're coming for multiple physio visits, we would probably recommend the cloth mask so that you can take it home and bring it back the next time you come in. You're also welcome to wear it wherever you want in public. Our chief medical officer is asking the general public to wear masks, and cloth is fine. If you are in a situation where you cannot maintain that 6-foot distance, so for those people that go to the city, public transit is the perfect example that she uses all the time, but something like a physio appointment would also be a great example, which is why we're asking patients to wear masks. As medical practitioners, those of us that will be coming within that 2-meter distance, the 6-foot distance of you, we will be wearing surgical masks, so that is why Ray is masked. You might wonder about gloves. You're welcome to wear gloves. The problem with gloves is that people have a tendency to think that they are more protected than they are with gloves, because gloves are no different than skin. When you touch something, it then needs to be washed, whether it's a glove or a hand. So we are actually not wearing gloves. We are just choosing to hand wash. And if you are wearing gloves, we will also ask you to sanitize or hand wash your gloves. So Ray will offer me a mask. I will put it on without touching this part. It should go over my nose and my mouth. I'm actually going to keep it off for the sake of this video so that you can hear me, because the voice does get a little bit muffled once your mask is on. But you as the patient would put your mask on at this point, and then Ray would give me some hand sanitizer. Or if you have, for some reason you are not keen on hand sanitizer, we do have one washroom available to you where you can go and use hot water and soap. And she will then go through the same screening questions with you that you have already answered on the phone the day before. And if the answer is all yes, then she will take you back to see your therapist in one of the rooms. So let's go back. We'll maybe just pause here. As you go back, you'll see that Randy or Taryn will be at the front desk. They are not wearing a mask because they spend their entire day on the phone and have to be nice and clear. And they are protected with this plexiglass barrier and should not have to come within that 6-foot distance. So that's why she is not wearing a mask. There are arrows on the floor for traffic direction, but in all honesty, we're at the moment having one patient in at a time only, so it's not a huge ordeal. Once you come into your appointment, you will see Chelsea or Emma or I, who will be masked because, of course, with a physical assessment, she will probably be moving your knee or ankle or some sort of body part where she is getting within that distance. Other than her mask, the rest of your physiotherapy appointment is exactly as usual. The room has been disinfected before you come. It will be disinfected after you leave. And when you're done with Chelsea doing your usual physio things, then we ask you to exit the other direction. And ideally, we will have taken care of any payment, insurance information over the phone before you come in. And then it's just less transactions at the desk. But if you can't do that, we'll just hold off because Randy's on the phone. Then Randy is able to take payment. As usual, we can take credit card, Interact, tap, whatever. If you have to touch the pin pad, again, we have the Cabicide wipes that we can wipe that down and keep everything absolutely clean, 100% protected. So you are more than welcome to come back for a physiotherapy visit. We are still doing telehealth appointments for probably about 50% of our population, because we're finding that it is about 50% of people that are just as well serviced through telehealth. So those are people that don't need manual therapy, that don't need needling, that do need some education, some advice, some exercises, some stretching, and that can all be done over telehealth. Thank you for coming, and then we just walk past the desk. Say goodbye to Randy.
See you.
And one other thing I should mention is we are asking you, if possible, to go to the bathroom before you come so that you're not having to use our washroom, just because we then need to disinfect behind every person that uses the bathroom. So the less people that have to use it, the better. As well, we ask you to come alone if possible, to try to leave your kids at home if you have kids. If you need a caregiver or somebody to help you, that is no problem. You can bring them as well. All right, thank you.